The next region that we'll explore is the spine and thorax. This is Chapter 4 in the Trail Guide to the Body text. We'll begin by attempting to palpate a very complex muscle group called the erector spinae. This muscle group has attachment sites along the thoracolumbar aponeurosis, the sacrum, the iliac crest, the spinous processes and transverse processes of the thoracic region, and the cervical region, all the way up to the mastoid process. So now we're going to take a look at the erector spinae muscle group on Lynn. So Lynn, can you just raise up just a little bit to activate and contract those muscles? So close to the spine, we can feel the spinalis. This muscle belly, these distinct muscle bellies right here, this is longissimus, and the muscle group out here is iliocostalis. So this is a distinct orientation to spinalis, longissimus, and iliocostalis, the erector spinae muscle group. We'll begin this palpation by locating the muscle closest to the spine, which is the spinalis. We will move just off of the spinous processes into the lamina groove and palpate this thin muscle as it makes its way from the lumbar spine all the way up to the cervical spine. We can see the distinct muscle bellies of the longissimus muscle. The spinalis is really close to the spine right here, longissimus, and on the outside out here is the iliocostalis. Go ahead and relax. So to palpate that, we'll locate the iliac crest, the spinous processes of the lumbar vertebra, and we're going to slide right into the lamina groove and move across the muscle belly of the spinalis as we trace it all the way up. Here's the lower trap coming in, so we got to palpate through the lower trap fibers. It's a little more difficult in the interscapular region. So we're coming all the way up to the cervical vertebra, except for starting at C2. And now we're going to palpate the longissimus. The longissimus originates on the common tendon of the thoracolumbar aponeurosis, the transverse processes of the upper 5 thoracic vertebra for the cervicis and the capitis, and the insertion is on the lower 9 ribs, transverse processes of the thoracic vertebra, and also the transverse processes of the cervical vertebra to the mastoid process of the temporal bone. So we'll begin by locating the large muscle belly. We're going to use just strum across this muscle belly. The lumbar region will follow it all the way up. And it's difficult in this region, in the interscapular region, because we have the lower trap, the mid trap, the rhomboids. This muscle group lies deep to those muscle fibers. So you lose some of that. You can feel it if you push through and onto the bone. You can feel the fiber direction running this way. We're going to trace it all the way up as we make our way to the mastoid process of the temporal bone. And now we're going to palpate the iliocostalis, the common tendon of the lumborum, the posterior surface of ribs 1 through 12. So this entire region on the posterior surface on the lateral region is where that muscle originates from, and then the insertion is on the transverse processes of the lumbar vertebra 1 through 3, and the posterior surfaces of ribs 6 through 12 through 6, and then also the posterior surfaces of 1 through 6, and the transverse process of the lower cervical vertebra, so the lower cervical vertebra. So we'll start on the more lateral margin, and we will move across the muscle, distinct muscle belly. The difference in the iliocostalis, it feels more tendinous because it has insertions on all the different posterior ribs. I'm going to trace this muscle up. Once again, about this region, the interscapular region, it's very difficult. We have to push through the other muscle groups to feel the fiber direction all the way up to the transverse processes of the cervical vertebra. Now we're going to look at the development on Kevin of his erector spinae muscle group. And what I'd like to have you do is just kind of raise your trunk up towards the ceiling. Good. And then just relax down. And just a little bit, raise up just a little bit. Perfect. We can see the tremendous development that he has in the erector spinae muscle group right here. So, and relax down. So on Kevin and his body type, with the amount of resisted training that he's done, we're actually able to do a pincer palpation on this muscle mass called the erector spinae. Most people, you'd probably do a flat palpation and strum across the respective muscle bellies. Now let's take a look at the quadratus lumborum muscle. This muscle originates on the posterior aspect of the iliac crest and onto the iliolumbar ligament. That's the origin of this muscle. It runs upward and attaches onto the 12th rib and the transverse processes of the lumbar vertebra 1, 2, 3, 4, and 5. To palpate this muscle, you have to move lateral to the erector spinae group. We'll use the thumbs to locate the lateral margin of this muscle belly. We'll trace it from the 12th rib all the way down to the iliac crest. The remaining portion of this muscle is difficult to palpate through the thoracolumbar aponeurosis and the erector spinae muscle group. The most palpable region is this lateral margin located here, lateral to the longissimus muscle. Now we're going to palpate the quadratus lumborum, which is located in the low back region. It attaches onto the posterior iliac crest.
Mr. Bowen's back again, and as we're palpating in the posterior pelvic region, you might encounter small fatty nodules or lipomas below the iliac crest or on the sacrum. These can range in size from a pea to a small marble.
And onto the iliolumbar ligament. The insertion point of this muscle is onto the last rib, the 12th rib, and the transverse processes of the 1st through 4th lumbar vertebra. So the location of this muscle is approximately in this region right here. And that we can just kind of outline that muscle like this. We have superficial fibers that run this direction, and the deep fibers run more from inferior to superior. In order to palpate this muscle, we have to move through the large longissimus muscle group. So we're going to move off of that muscle group and come down onto the muscle fibers. You can use just a strumming across the muscle fibers of the quadratus lumborum. Now we'll take a look at the relationship between the different abdominal muscles. So running down the midline of the abdomen is the rectus abdominis. It's the most superficial muscle group. Then we have the external obliques running here, the internal obliques running off the iliac crest and lateral inguinal ligament underneath the external obliques, and then the transverse abdominis muscle group coming from the back around to the front. We also have the deep portion of the abdomen, which is the quadratus lumborum. So let's take a look at the activation of this muscle group. So Len, if you can exhale your air out, draw your abdomen towards your back, and then raise up just a little bit. We can see the distinct margins of the external obliques here. Here's the multi-bellied aspect of the rectus abdominis, and here is the internal obliques over here, and relax. Now we're going to palpate the rectus abdominis muscle. We'll begin by contracting this muscle. So Len, can you flex up? We can see the distinct multi-bellied aspects of this muscle, the muscle borders along here, and relax. Thank you. This muscle originates on the pubic crest and pubic symphysis. It runs up and inserts onto the cartilage of the 5th, 6th, and 7th ribs, as well as the xiphoid process. We'll begin the palpation at the pubic crest. We'll just use a flat palpation technique as we move across the muscle bellies. We'll follow it all the way up to the insertion points on the ribs and the xiphoid process. We can also, in the soft part of the abdomen, use a pincer palpation technique to lift the distinct muscle bellies. And then we transition into a flat palpation on the cartilage of the ribs and the xiphoid process. We're going to utilize the skeleton to identify the origin of this muscle, which is on the pubic crest and the pubic symphysis on both sides. It runs up and attaches onto the cartilage of the 5th, 6th, and 7th ribs and the xiphoid process. This multi-bellied muscle runs down the midline of the body on each side. Now we're going to transition and palpate this muscle on Kevin. And first we're going to contract this muscle. So Kevin, can you just raise up for us? We can see the multi-bellied aspects of the rectus abdominis outlined here very clearly on Kevin's abdomen. And go ahead and relax. To palpate this muscle, we need to locate the crest of the pubic bone. So we're going to just use a flat palpation to locate that. And we're going to do it on both sides gently in this area. And then we're going to use just kind of a pincer palpation to trace this muscle all the way up until we make contact with the ribs here, and then we're just going to palpate up, and we're going to count actually down from the top so we can locate the xiphoid process, which is one of the attachment points for this muscle. And then we're going to locate the first rib, second, third, fourth. Here's the fifth rib. So on the cartilage, so we need to move lateral just a little bit. Cartilage of the fifth, sixth, and seventh rib, and the xiphoid process. So that muscle comes all the way down here on one side. Let's look at it from the other side. So we're going to palpate the first rib, second rib, third, fourth, fifth rib. So this muscle is actually running, the pec is on top of this muscle, parts of it anyway, and sixth and seventh xiphoid process. Let's just use a flat palpation. This is the linea alba that runs down the center, a thick connective tissue aspect of this muscle. So we're just going to use a flat palpation to slide across this connective tissue all the way down to the pubic crest and the pubic symphysis, which is in the center. We can outline this muscle also using a pincer palpation. But probably the best way to feel the muscle fibers is to use a flat palpation. And then can you just raise your stump up again for me? Good. And I can feel the distinct muscle bellies contract. And I can really get a sense of the mass and the size of this particular muscle group. Go ahead and relax. Thank you. So now we're going to look at the external and internal obliques. So we have the rectus abdominis down the center, running off the lower 8 ribs and onto the iliac crest, into the abdominal aponeurosis to the linea alba is the external obliques. Their fiber direction runs this way. So Kevin, can you just kind of lift up your left shoulder and roll forward? Good. Yeah. All right, relax. So I can feel those distinct muscle fibers as they attach onto the lower 8 ribs. And then as we move towards the midline, things flatten out because this is a large sheath of aponeurosis here. We can also feel onto the iliac crest, the anterior iliac crest. Go ahead and roll up again so I can feel. Good. So I can really get a sense of the borders or the margins of this particular muscle group as well as it runs down and attaches into the linea alba. And relax. So Lynn, can you raise your left shoulder to your right hip? Here are the distinct muscle bellies of the external obliques, and relax. This muscle originates on the lower 8 ribs. So we'll begin by locating the floating ribs, number 12, 11, 10, 9, 8, 7, 6, and 5 ribs. So we'll palpate this muscle. Mostly you'll feel the muscle belly on the rib attachments. So we'll use a flat palpation. We lose the muscle belly at the cartilage edge. We'll come back onto the next rib, use a flat palpation and roll across the fibers. We'll move down to the next rib and use the transverse palpation technique to feel the muscle fiber direction. Becomes a little more difficult to feel on the floating ribs. And the insertion is on the anterior portion of the iliac crest into the abdominal aponeurosis and the linea alba, and it's very difficult to palpate the distinct aspects of this attachment site. Now we're going to palpate the internal obliques, And we'll focus once again on the left internal oblique. We'll begin by contracting this muscle. So Lynn, can you raise your right shoulder to your left hip? So this muscle runs underneath the external oblique. It runs in this direction, right along here, and relax. This muscle originates on the lateral aspect of the inguinal ligament, the iliac crest, around to the thoracolumbar aponeurosis, and the internal surface of the lower 6 ribs. This muscle inserts into the abdominal aponeurosis to the linea alba. So to palpate this muscle, we'll start at the inguinal ligament, along the iliac crest, using a flat palpation technique. And if we're not sure if we're on it, we'll ask Lynn to activate it again. Can you raise that shoulder up and relax? I can feel the muscle fibers underneath my fingers. I lose the muscle belly approximately here, so I'll move out. Can you just raise that one more time and relax? Thank you. So we're just feeling for the fiber direction through the external obliques. So this muscle is deep to the external oblique. Once again, it's difficult to palpate into this abdominal aponeurosis. It's a flat sheath, connective sheath, and we can just use a flat palpation to feel the distinct aspects of that portion of the insertion and along the linea alba. Running the other direction off of the lateral aspect of the inguinal ligament, iliac crest, thoracolumbar aponeurosis, and into the undersurface of the lower ribs is the external obliques, or the internal obliques. They run this direction. So we've got external obliques running here, internal obliques running underneath. So in addition to this, another layer deep into the abdomen is the transverse abdominis, which runs also off of the lateral aspect of the inguinal ligament, anterior iliac crest, thoracolumbar aponeurosis, runs around transversely, as the name spells out, and attaches into the abdominal aponeurosis. And can you just kind of exhale out for me? Just take a nice deep breath so we can kind of see the margins. This muscle runs right along here, deep to external oblique, internal oblique, and the rectus abdominis. And relax. The musculature of the spine and thorax is extremely complex and an important aspect of the human body. The ability to locate the distinct muscle bellies and tendinous attachments is difficult. It's important to use intention and focus as you attempt to locate the respective muscle bellies and tendons of this important and complex region of the body.